Well, we're going to get started now, so I just want to welcome you to Pain BC's webinar today. Today's webinar is what healthcare providers should know about acupuncture for chronic pain patients. And this is part of our monthly interdisciplinary webinar series for busy healthcare professionals like yourself. So thanks for joining us today. I'm Leah Chang. I'm the Pain BC Education Lead, and I'll be moderating today's webinar. So I'm just going to introduce our presenter today. Scott Livingstone has graciously given us his time and expertise, and really excited to talk to him. Scott is a registered acupuncturist with the College of Traditional Chinese Medicine Practitioners and Acupuncturists of British Columbia, and he's practiced acupuncture for 7 years, and you may know his clinic, which is Livingston Acupuncture, located in Richmond, BC. And you'll hear from Scott's lovely accent today that he's from Australia, and maybe I should have asked for prizes to guess where he's from, but he was a former personal trainer for 3 years. He worked as a software business analyst in Canada. He also worked in the US for 10 years, so he's got quite a lot of experience. He even worked as a desk jockey for a decade, and that's when he decided he hated sitting behind a desk, so he made a change and he found a passion for helping people with pain, and that's where we come in today. So today in the webinar, Scott will share from his experience about the benefits of acupuncture for chronic pain, and also for you, what to look for when you're referring your patients or clients to an acupuncturist. At the end of the session, we'll leave about 15 minutes to answer your questions, and you can submit your questions using the chat today.
Okay. I was a techie nerd, I guess I still am, and I figured life was too short, and I had a midlife crisis and decided to go a completely different way and help people and be of service. So I went out and I got certified as an acupuncturist, and I haven't looked back. I love the challenge of seeing all different types of ailments, and like the best part of my day is sort of going home and saying, this is what I achieved today, and helping people improve their quality of life, which is something that I rarely got sitting behind a desk and typing on a computer all day. I'm hoping that we get some really rewarding questions and answers and feedback today, and I hope that everybody gets a lot out of it. So today we're going to talk about acupuncture and myths and facts, common misconceptions that people might have, professional regulation certification, how an acupuncture treatment works with a chronic pain patient, what to look for when referring a patient, some scientific studies for you, for those of you that need the extra proof, the treatment plan. We'll have a couple of examples and case studies. We'll talk a little bit about integrated clinics and how those are popping up a little bit more. And then we'll have some time for questions. So, moving forward, we have another poll. So today, we're going to ask, what is your current level of understanding of acupuncture? Advanced, intermediate, basic, or non-existent? Doing well. Okay, we'll give it a few more seconds. Looks good. Okay, we'll close it up there. And it looks like we have intermediate and basic, the major categories here. So yeah, this will be a really good opportunity for us to do some education today. So, myths and facts of acupuncture. Let's start with that. The first, we're going to do a poll. Surprise, surprise. The first myth or fact: acupuncture, does it hurt? All right, so 2/3 of you think that it's a myth, and 1/3 of you think it's fact. So the answer is, it depends. So what we usually do with I usually show people this graphic. How tiny is the acupuncture needle in comparison to other things that you could possibly stick into yourself? But a lot of the time, it depends on where the needle is actually penetrating the surface of the body in terms of anatomy. We look at nerve concentration, and sometimes it's personal sensitivity of the patient and whether they have a high anxiety level when they begin. So a needle going into the glute is going to be a lot less sensitive than somebody that's going to be treated for, say, plantar fasciitis, where it's going into the bottom of the foot. Is acupuncture safe? Okay, got some good answers there. All right, we'll close that one down. And majority of you say it's fact, and I would agree with you. So it's safe in the hands of a licensed professional. We have a very stringent licensing organization here. It's called the College of TCM Practitioners and Acupuncturists of British Columbia. It's governed by Health BC, and very extensive testing and rigorous screening process for acupuncturists and licensing, the same as you would with a lot of other professions. This is a common one that we see. Is IMS the same as acupuncture? Yes, it would have the same name if it was the same thing, I would assume. But this is the general comparison that we usually use with IMS and acupuncture. IMS being intramuscular stimulation. They both use acupuncture needles. Different sizes are available for different sort of techniques. The insertion points in IMS are based on muscle tension and internal anatomy, whereas acupuncture uses different specific surface anatomy and predefined points on the body for particular conditions. For IMS, particularly, they're looking for a muscle spasm or a cessation of a muscle spasm, whereas acupuncture, you're usually leaving the needles in for the duration of a treatment. There's a different level of stimulation. IMS is typically it's targeting the nerve endings, and it's a little bit more intense, and it's used for pain relief. And acupuncture is used for muscle spasm and rehab and recovery. And there's different levels of training. IMS sort of requires an existing education, whether you be a physio or an MD or something like that. So there's an existing level of, it's an additional training that you do on top of a degree, whereas acupuncture is fairly extensive training specifically about needling and where to put the needles. What is the difference between a registered acupuncturist and a doctor of Chinese medicine? So this is one that commonly gets asked, and specifically if you're looking to refer patients to a doctor or an acupuncturist, it might be handy to know what the difference between them is. So yes, a doctor of Chinese medicine is able to prescribe herbal formulas, whereas a acupuncturist is not. It's basically an additional level of training on top of acupuncture. So a doctor of Chinese medicine will be able to perform acupuncture and provide custom herbal formulas for the patients. So this is a typical level of training well, it's the minimum level of training that are required for certification within BC. Other provinces, I guess they're trying to standardize that across Canada. But yeah, it's literally 5 years of study for a doctor of TCM, in addition to several exams at the college board level. Okay, so why do you need to know this? Well, understanding the difference gives you and your patients more informed treatment options. Herbal formulas are typically taken daily and can reinforce other treatments that are being provided to patients. And but sometimes you'll find that some patients can't or won't comply with herbal treatments or with pharmacological treatments in general. So It's handy to know who to sort of send a patient to if they're asking, and knowing the difference is really handy. What do we do when we provide an acupuncture treatment, specifically for chronic pain? We actually sit down with a patient in the beginning and we get a full patient history and assessment. In addition to just the condition that they're coming in for, we look at other factors that may be affecting their life. We do range of motion tests, pain scales. We develop a baseline for how we track the progress of the treatment. We do environmental assessment. We look at the potential triggers and stresses in their life, other extenuating factors. The time that we're able to spend with a patient is usually a little bit longer than they would with, say, a standard GP appointment. And so we can actually get into a little bit deeper diagnostic perspective, and that becomes really handy, especially with somebody that's seeing multiple practitioners, or maybe seeing for certain types of conditions. That it's helpful to be able to sort of share that information if the patient needs that to happen. We develop an individualized protocol where we develop for that particular patient. There is no one treatment that's for one particular condition. Every patient gets their own protocol, and then we usually follow it up with homework for a patient. Sometimes it's just increase their hydration. Sometimes there's a stretching routine that we would incorporate into it. Sometimes it could be dietary recommendations, following up with other practitioners. So it's not just a one-way street. They don't just come in here and put their feet up. There's actually work that we do. I like to think of myself as a navigator, and the patient is the driver, and they've sort of swung off the road a little bit, and we're just sort of easing them back on to a sort of a healthy road. And that's the way I like to sort of treat a patient, is to make them the advocates for their own health. If they're not receiving the best care from me, I usually would refer them out, or wish them well and hope that they find something else that works for them. They're the boss, and if it's not working, why would you continue doing something that doesn't work? And like I said, there's no one-size-fits-all model. Every patient is independent and individual, and comes in with a very different history. So there's no magic pill that treats every condition. So we'll give an example, a case study. When we look at something like a headache, and somebody comes in for a chronic headache, the first thing I would ask is where is the headache located in the head itself? If it's an occipital headache, there's a number of different triggers for that: neck tension, stress, posture. Typical desk jockey sitting over a computer with poor posture, like hunched shoulders, and then by the end of the day they'll have conditioned their body to develop that sort of headache. Vertex headache usually revolves around stress or anger and emotion, blood pressure, that sort of thing. It's a different type of pain. It's a different type of headache. Can be quite throbbing, and we look at it and we treat it completely differently to the other type of headaches. Temporal headache, I see a lot of this in TMJ and bruxism, eye strain from sitting behind computers, and worry and anxiety. Sometimes that's we see a lot of behavioral and psychological impact of even having a physical injury can trigger emotional and psychological impacts as well. And then sometimes you'll see the frontal headaches, which is common around allergy season for sinus infections and sinusitis, and other times it could be dehydration and nutrition. There's a number of different reasons, but the typical sort of solutions to those. But again, we look at all the different factors that can be coming up. So in addition, we'll do a history. So sometimes you'll dig up things like old injuries, like post-concussion syndrome, PTSD, the work environment, and they may have had motor vehicle accidents in the past or even currently that they may not attribute themselves to the actual headache, but can be triggers to the actual event. In addition to things like weather, food, relationship stress, and sometimes there's sensitivity to temperature. So we'll find that people are really triggered by that. And then we'll customize the treatment to resolve the root cause of the headache. So it's not just, we can sort of solve a number of different things at once, but we don't want to just treat the headache itself. We want to sort of get to the root of it and say, you know, if the emotional cause of it, we'll treat the emotional stresses and things like that, in addition to treating some of the symptoms of the headache. What are the roadblocks you see as a practitioner referring out to an acupuncturist? So, majority of you think it's efficacy. Does it work? So that'll be really interesting. Today might actually answer that question for you. And patient resistance is a second place getter there, and that one I usually solve that one with education. So yeah, this will be interesting to see if you have a different answer at the end of this seminar. So, referring chronic pain patients. Dark as it may sound, my first clinic was going to be called The Last Resort. And a lot of my patients were coming in to see me, and they were saying, "I've tried everything. I have very little hope left, and I just do whatever you have to do, but you're my last resort." It's not a positive sign, and I want to be able to sort of say, hey, this is there are other last resorts. I would think in some cases, especially for chronic pain, that surgery might be a last resort, or medicating with opioids or something like that is trying everything that you can is a better result, rather than just sort of throwing something at a wall and hoping that it sticks. The psychological impact of chronic pain is immense. When somebody comes into work and they're in pain, or even around the family and stuff like that, people are being judged by their peers or by their family, and especially if it's something that is unseen, a lot of the time their self-confidence is eroded, and they're being judged by other people they think they might be malingerers or something like that, and it has a big impact on their healing. And many patients are averse or have high tolerance to opioids, and this is another option to give people hope, or to give practitioners hope in terms of, like, we don't need to prescribe a pill when we can look at other options, and that's what I'm sort of hoping to sort of provide today. So what to look for when referring a patient? Well, the first thing is, I think one of the roadblocks you might have seen is whether we're qualified. Well, you can easily go to the CTCMA website to see whether a practitioner is qualified to practice in BC, and usually you can just type up their name and to see if they're registered, and that would be the first thing I would do when somebody is referring. If you get a recommendation by another patient or a colleague, that usually comes with a lot more weight, and majority of my recommendations and my patients usually come from referrals. It's a lot higher quality than sticking your name in the yellow pages and throwing a dart at it, because obviously somebody's had a really positive experience and they're willing to put their name out there and put their stamp on it. High quality personal interaction and networking with practitioners. So yeah, if you're out there and you're meeting other acupuncturists and things like that, and you develop a trust relationship, that's perfect. And Google reviews, sometimes, you got to take that with a grain of salt, but sometimes if you see a majority of positive reviews from patients and from other practitioners, sometimes that can be a handy sort of go-to as well. And is the clinic or something like that, are they accessible? So if the patient doesn't have access to extended medical health or MSP, sometimes you can refer to what we call community acupuncture clinics, where the cost is a lot lower and they see a lot more patients at different times. And so understanding the difference between them is kind of what we're going to be talking about today as well. So here's another case study. I have a good relationship with chiropractors and physios in my community here, and a lot of the chiropractic patients will come and see me and try to have back-to-back appointments with the chiropractor down the road, because they'll see a muscular relaxation with their nervous system being relaxed and walking out of here loosey-goosey, and then they'll go and get structurally manipulated by the chiropractor, and their healing is actually a lot more long-term. They see a lot more impactful results, and working together with other practitioners is fantastic, because everybody wins in terms of the patient sees much more positive results, and there's no territorial or fiefdoms or anything like that, and in the grand scheme of things, the patient is what we're looking to solve. And here's another case study that I see quite often, not necessarily postpartum, but even partum pain. So I see a lot of pregnant women that are unable to get pain relief during pregnancy. So this is a very safe method of pain relief during pregnancy. I'll see some people for back pain, nausea, morning sickness, things like that. Generalized tendinitis and things like that comes with during pregnancy, and the hormonal flip-flopping that goes around when you have a baby inside you. Working together with midwives and OBGYNs and other practitioners in that sort of environment is really handy and helpful for providing somebody that can't take medication during pregnancy to give them some level of relief and relaxation. Yeah, I wanted to talk about integrated clinics, and I think there might be some people online that are involved with integrated clinics. What are they? They're multidisciplinary practices with varying modalities, lots of different practices all rolled into one. And the idea is the patient sort of goes in, it's a mall of medicine. You can go in there and see a bunch of different types of treatment in the one visit. A lot of the time, if you're sharing information about your condition, sometimes you can find the best. The practitioners can get together as a group and work out who is the best possible treatment for that particular condition. And that's becoming a lot more common, and it becomes more patient-centered, which is fantastic. So here is, I've got a couple of different scientific studies that specifically about acupuncture. This is a big one. This is an 11-year study of 122 different conditions, and only 5 of those were rated that there was no effect. So when we talked about the roadblocks you might see in terms of efficacy, it's no longer possible to say that the effectiveness of acupuncture is because of the placebo effect, or that it's useful only for musculoskeletal pain. So, 117 conditions that they tested had varying degrees of success, and that's it's a really it's a long-term study. This is electroacupuncture, where we provide a stimulation to the needles. And a lot of the time they're using it for anesthesia, and they're using it for, in this case, they use it for inflammatory neuropathic cancer and visceral pain in the corresponding animal models. But I've actually seen electroacupuncture used in surgery in China. They've done open heart surgery with it, and they've used it during childbirth without any anesthesia. So it's actually quite remarkable to see in real time. Here's another one. We talk about IV morphine and the management of acute pain in the emergency department, and they found that 92% of the acupuncture group were found relief versus 78% in the morphine group. And here's another one. We talked about acupuncture for chronic pain. It's a fairly recent study in the last 3 years. 50% of the study group found relief versus 30% in the control group. So that was a positive result there as well. So yes, we're at question time. So if Leah is back, let's see if we've got any questions.
Yes, I am back. Thank you for your patience, everyone, with my technical difficulties, but I'm glad that we were able to continue. I do have a question from the community here, Scott, I can send your way. But one of them was, what type of chronic pain conditions have you helped? So do you have any examples?
Ooh, usually one of the things I ask in my intake is I actually track what type of condition that the patient will come in for, whether it's back pain, neck pain. You know, and the majority of cases, pain is the number one reason that people will come in for, but back and neck pain is probably number one, followed by joint pain, whether it be knee or elbow, sometimes wrist for things like carpal tunnel, and arthritis, things like that. But those are the major areas in a majority of cases for chronic pain.
Great. You also mentioned that you've had some fibromyalgia, some CRPS clients in the past. Maybe you can speak to anything you've noticed, like about those chronic conditions that are just so hard for all of us to treat. You know, even some arthritis, right?
Yeah, it's one of those things where it's like sometimes it's environmental, where we like providing the patient with the right education. Sometimes even something simple as allergies can be diet related, and a lot of the time the patient just isn't either aware of it or they've never considered it, and getting them sort of more well-rounded and understanding about their health is kind of key. And when we talk about chronic conditions like fibromyalgia and pain in general, yeah, I've had some really good results with those type of things used in conjunction with their other treatment modalities. It just a lot of the time it depends on the commitment of the patient and the extenuating circumstances sometimes with what else is going on in their life. Because, like I said, the emotional impact of pain can have a really detrimental effect on the healing as well.
Okay, thanks. We've got a few more questions coming in. I'll just read them out to you. We have one question that's asking, is there any role for acupuncture in elderly living with residential care? This person recommends asking about dementia versus non-dementia patients. So what role could acupuncture play with the elderly?
It's interesting. I mean, it's a really good question. I've actually visited, there's some cases where I actually go out and do mobile treatments for facility care and things like that. So it wouldn't be foreign. I think you'd probably need the buy-in of the family as well as the facility in terms of education and stuff like that. But I think it would be remarkable in terms of the success that you could have with a population like that. Because I treat a number of different neurological type conditions, and I mean there hasn't been too many studies on dementia, but you know, I'm sure that there would be you know, as an alternative to medication, I think it would be a really interesting sort of option for people to sort of go with.
Mm-hmm. Great, thank you. Another question we had is, do you struggle with getting funding from different insurance companies? So, you know, if people are coming to you with maybe motor vehicle or maybe disability claims, that kind of thing, what's been your experience with insurers?
Well, I don't direct bill, so I haven't really had to face that hurdle. But you know, like I've treated a lot of motor vehicle type accidents and work-related injuries and things like that, where people have had to, you know, have lawsuits, and you know, a lot of the time, you know, sometimes you have to work with the attorney to work with like contingency based litigation and things like that, and most of the time I'm sort of the person's just it becomes part of what they call Schedule 7, where they just accumulate their expenses and you know, make it as part of the settlement.
Great. Well, thanks. And I was just going to add from the Pain BC perspective that we recently had a discussion about this very question. So how does it work when you have clients or patients that are dealing with insurance claims? We did an Ask the Expert on Live Plan B, so that's liveplanbe.ca. And the insurance lawyer gave us quite a lot of advice, so you're welcome to refer to that as well, and I'll send that out to all our participants today. But that's a really good question. Thanks for sharing your experience with insurers. Here's another one. Someone's asking, what about acute pain? How is acupuncture helpful, for example, with fractures?
Well, I have a really good example of that one. Acute pain it depends on how long the patient leaves it. And when I say leaves it, it's like finding care, because sometimes something as simple as a sprain can develop into something else. But with a fracture, I actually had a patient that had a very mobile job. They're a salesperson, and they'd fractured their ankle. And we're able to work together to resolve, they were in a soft cast, and I was able to treat the inflammation and promote the healing in that probably, several times faster than just rest, because the area was able to be flushed and promoted with fresh cells, faster than say massage would be able to with a fracture would be quite difficult. And they were able to get back on the road and on their way faster. So there's certain types of acute injury that respond really well. Obviously I'm not going to be a bone setter, but for a lot of times the faster that you act on an acute injury, the faster you'll get relief.
Okay, thank you. We've got a few more coming in. This is great. Thank you for all your questions, everybody. How much of your choice of acupuncture points for treatment is related to pulse diagnosis versus shotgun points like Hoku and ST36? I hope I'm pronouncing that correctly. Let me know if you want me to repeat the question. But
so a lot of the time, there are many different styles of acupuncture. There's a Korean, Japanese, Chinese, and some people, even within those, there's different schools of thought. So sometimes it's based on the practitioner's, intuition. Sometimes there are prescribed points that you would use sort of fairly standard for particular types of conditions. So I use pulse and tongue diagnosis in the majority of my cases. But I also use Western medical diagnosis as well. And I use sometimes as gut. There's no single sort of way that I would diagnose. Sometimes it's every practitioner will look at a case on an individualized basis, and so I don't really have a blanket answer for that one.
Okay, yeah, that's fair. Great, thank you. We have a really interesting question that's specific to a chronic pain. This is about neuropathic pain, so thank you for this question. I'll just read it out to you, Scott. I have a client with significant neuropathic pain. The acupuncturist is utilizing a modality called CENAR. It's spelled S-C-E-N-A-R, CENAR therapy, as she and her pain is so significant, she doesn't tolerate the needles. So this person is not familiar with this modality, and she's not getting the support from the GP that she would expect. So she's wondering what your experience is with the CENAR treatment.
I can't say that I've heard of that one either. It may be laser acupuncture. It may be like the brand name of the type of acupuncture, but I can't recall ever hearing of that one before.
Okay, well, yeah, we'll look into it. I haven't heard of it myself, but thanks for bringing that up to the person who sent this question in. Okay, here's another one. This is great. We've got lots of questions coming in. Someone's asking us if we can compare the use of cannabis with acupuncture for chronic pain treatment. So that might be a tricky one to answer, but I don't know if you have any experience, Scott, about patients asking about cannabis or using cannabis, medical cannabis for chronic pain.
I don't think there's been any sort of definitive studies on that one. It's a fairly recent, I think it only becomes legal to have your own in Canada on July 1st. So I think that will become more and more the research on that will probably become more empirical, just through trial and error within practices. And I think people, I've got some patients that come in and they use it medicinally and as an adjunct therapy for pain relief, sort of in between. And I don't see a problem with it as long as it's being monitored and it's not being anything in excess is going to cause problems.
Mm-hmm. Yeah, it's pretty exciting that there's a lot of new studies just starting now. So we're looking forward to a lot more evidence on the use of medical cannabis, and hopefully we'll see how that relates to acupuncture. And we'd be happy to share that as those studies come out. I have another question here, which is asking how often you recommend scheduling treatments with patients with chronic pain. So do you see them more regularly? How often? What's the frequency on that?
Usually when a patient first comes in, I want to see them probably 2 to 3 times within that first week. It's kind of, I liken it to your first workout at the gym, and you're going to be a little bit sore and your body's going to sort of sit there and rebel a little bit. And so you may see an uptick in terms of relief, and then the body will be conditioned to try and return to its level of homeostasis and what it's used to. Sometimes it's a postural issue, sometimes it's used to being in pain. So hitting it again within that first week is usually what I would recommend. And then based on the condition itself, or in terms of how quickly the patient responds, the treatments would spread out and to a point where you would get to a maintenance perspective or even a proactive perspective from the patient coming in and hoping to be proactive rather than reactive about the health.
Mm-hmm. Oh, thank you. Okay. We've got 2 more excellent questions. I'll give people a last chance to add any more here, but this one person is asking, have you treated chronic neuropathic pain due to nerve injury? So I'm glad someone's asking this because we do have a lot of constituents with this particular issue. So, and if so, what's your success with this? And if not, how do you think you could successfully treat it?
Well, if you would count stroke under that, then yeah, there's quite a bit of research on that one. Specific neuropathic pain, it varies. It's like I can't say it's 100% successful because it is such a difficult one to treat, and it's very frustrating for not only the patient but for me as well, because I want to do the best that I can for the patient. But neurological pain is so slow to react, but for sort of like reconnecting the wires in our heads, we have a lot of success with stroke rehab and sort of those neurological sort of deficits.
Mm-hmm. Great, thank you. Another question is, I've got a pick here, there's so many. Okay, we have one question, this is great, asking about if you've come across any studies on the efficacy of acupuncture related to complex regional pain syndrome. So we chatted earlier just about if you had any CRPS clients, and I'm not sure, I don't know of any myself, but perhaps you've come across some.
No, I mean, not specifically. I mean, I'm sure that a Google Scholar search will probably turn up something, but in terms of that specific case, no, I haven't seen anything.
Mm-hmm. Okay, I'm going to look into that myself, and I'll probably get back to the group on this. Okay, great. Another question is, what's a recommended approach to chronic pain management? Acupuncture treatment immediately before or after body work?
Again, I would err on the side of caution and say it depends. I do work with RMTs and craniosacral, osteopaths, things like that. Yeah, I guess it depends on the type of condition, and the majority of times it's scheduling. the patient is usually the one that is dictating when they're available to be treated. So it's not like you can sit there and say, come in and see me on this date. It's you know, I'm not available. So it's just whenever you can get to see them. There's not any. I don't think there's a rule that would be hard and fast for any particular type of condition, but no, I think just basically using them in conjunction, you know, when you can, you know, the patient will be able to sit there and give you the feedback once you develop a baseline.
Mm-hmm. Yeah, I'm glad you mentioned too that people with chronic pain have other challenges. You know, like getting to appointments can be also very tricky, and planning ahead. So whatever we can do to help them return to function and you know, be able to do some future planning and that flexibly persisting model, that's what we're all aiming for. Yep. So fantastic. I'm going to end with one last question, and this is a great one to sort of wrap things up. This question is, what do you recommend as home follow-up after an acupuncture treatment?
The biggest one, hydration. Like majority of people in that are walking around today are dehydrated, and especially after an acupuncture treatment where we are there's a histamine effect that occurs when we stick a needle in somebody, and we want to be able to flush any sort of debris and you know, sort of old cells out through the kidneys and the liver, and be able to sort of do that. You need to be better hydrated, and a lot of people are just walking around, you know, unaware. But you know, they say, "Oh, I'll get my 8 glasses," and I think in some cases it's understated. But that's probably the biggest one.
Mm-hmm. It's good advice for all of us. Yes, thank you, Scott. Well, I appreciate your time today, both participants and our presenter. I'm just going to wrap up today's webinar, and just to remind you to take a few minutes to share your thoughts and feedback in our post-event survey. So thank you very much. Thank you to you, Scott.
Hey, thanks everybody.